Acupuncture is an ancient Chinese healing modality that dates back over 3,000 years. It uses fine needles or heat to balance a person's energy. We're clearing the channels and collaterals. It's rather curious how I got turned on to acupuncture. I was studying Indian mysticism and Eastern religions in India 10 years earlier, and another person, Alan, had been in China studying acupuncture, and he pulled out these needles as we're sitting waiting to see a holy man, and he's needling me for a headache. And as the needles were in for a few minutes, my headache went away. And I was totally mystified by it. And so a few years later, when the option came up, I started studying acupuncture. Bodywork's a much broader term, which encompasses many different techniques. So I've studied hands-on techniques, I've studied osteopathic, craniosacral techniques, and I bring them together uniquely to fit the patient I'm working with. If I can feel it with my hands, if I put my hands on the body and I can feel a problem with my hands, I would use hands-on therapies. If I can't feel it, or if it's so intense it hurts too much, then I'll use acupuncture in conjunction. So I might use acupuncture needles to start releasing a muscle structure, and then I'll go in hands-on and finish that work. Zero balancing was developed by an osteopath, Dr. Frederick Smith. I've studied with him since 1993. To this day, his teachings influence nearly all of my practice. He would say, think about at least one needle that would be useful for this person. And so along with my other treatment, I would put one needle, which it's curious in a study when you're told to find the one perfect point, because it takes our mind in a whole different direction. When we're looking at this person, we're looking at what would be that one little nudge that could change everything. For our mind and stresses, we've learned to think of therapists and psychiatrists and things like that. And those people, those type of practices work with what we hold inside. I've found my work works on the container that holds those things. So I'm working on a person's postural position so that they feel more alive. How do we get them breathing? How do we get them opening up? People take their car and get it serviced every 3 or 4 months. I feel your body's far more important than your car. I like the term complementary medicine far more than alternative medicine. Complementary medicine techniques like acupuncture work really well, completely integrated into and around Western medicine. Many times I'll have a person on my treatment table and said, you know, we really have to have an MD check this out and have some tests done. Or one doctor would often send people to me to see if I thought they needed an MRI, because he knew my hands were skilled enough that touching an area, I could call him back and I say, yes, I really think they need an MRI of that disc or that joint. When I treat patients, I rarely walk into the treatment room with a plan as to what I'm going to do. I start handling them and let it unfold what the session is going to be. And I find that keeps my work fresh, it keeps it interesting to me, and more than anything, it keeps me in the moment with the patient. Because I think we all lack the intimacy of someone being completely present with you. I find that's where healing starts.